Hi, I'm Kat from Perinatal Support, and today we're going to do a transverse abdominis activation in coordination with your breath. So your transverse abdominis is your innermost layer of abdominals. It attaches in the back into this big network of fascia called your thoracolumbar fascia. It wraps around the two sides of the waist and around to the front of your body. And so if you are pregnant, all of your guts and all of your baby stuff is underneath your abdominals, so they're on the outer layer of your body. And then the two sides of your transverse abdominis attach into another line of connective tissue or fascia called your linea alba, and that connects all the way up from the bottom of your sternum down to your pubic bone. So basically everywhere where there isn't bony structure in your torso, like your rib cage or your pelvis, there is that transverse abdominis. It kind of looks like a corset. So if you look up the anatomical function of your transverse abdominis, it is to compress abdominal contents. And so we're going to practice doing that today. Typically, when you inhale, your transverse abdominis and all of your abdominals expand slightly. And then when you exhale, they gently draw in slightly. And that's just in response to really normal changes in intra-abdominal pressure, so pressure within the abdominal cavity, in response to your breathing and diaphragmatic movement. So we're going to take advantage of the fact that your abdominals gently draw in on your exhale, and we're going to use that to engage your transverse abdominis and compress your abdominal contents. So put your hands down on your belly, and first you're just going to take a big inhale and let your belly expand. And then as you exhale, I want you to think about drawing your belly in, and you can think about narrowing your two front hip points in towards each other and gently lifting your navel. We'll do that again. So inhale, the abdominals relax and they expand. If you're pregnant, as you exhale, you can think about gently hugging your baby in and lifting your belly button up. One more time. Inhale, the abdominals relax and the belly expands. And then exhale, the abdominals draw in. You can think two front hip points narrow, and then there's a gentle lifting of your navel up. And then let that go. So that is the activation of your innermost layer of abdominals called your transverse abdominis.